Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lanre Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic hosts.
On this episode, we have part one of a two-parter exploring lifestyle medicine. What exactly is this up-and-coming field? What are its 6 main pillars? And how can it change all of our lives for the better? We're talking to an expert today who shares all that and more. Hey, Lon.
Hey, Lise. I'm really excited about today's guest. So, do you think there's any chance that she'll tell us that lifestyle medicine means dropping everything and moving to the beach? Maybe?
Yeah, I mean, that is exactly what it sounds like, right? But
Yeah.
Alas, I have a feeling, Lon, that the odds are low on that one.
Oh, man. Darn it. I was just going to cite that and then send in my resignation letter and
Right, exactly.
move to Costa Rica.
Let them see the back of me in the distance with a puff of smoke.
Right. Okay, fine. You're right. Maybe there's a bit more to lifestyle medicine than that, but the research and outcomes are undeniable. So what we're hoping is that this sparks an interest in you, our listeners, to seek out a physician in this specialty and apply some of its tenets to your own lives.
Yes, indeed. So our guest today is a triple board certified physician, certified in endocrinology, internal medicine, and lifestyle medicine. She is an associate professor of medical sciences at Quinnipiac University and a locum tenens physician at Baystate Medical Center in Springfield, Massachusetts. She currently sits on the board of directors of the American College of Lifestyle Medicine, where she also serves as chair of the Endocrinology Member Interest Group and previously served as a subcommittee co-chair of the ACLM's Women's Health Member Interest Group. She has been an invited speaker at numerous regional, national, and international conferences and has published several journal articles and textbook chapters on both endocrinology and lifestyle therapeutic approaches. She lives in Connecticut with her family. Welcome, Dr. Mahima Gulati.
So glad to have you here. So let's get right to it. How do you describe lifestyle medicine to people who are unfamiliar with what it is?
First of all, thank you, Lanre and Lisa, for having me here. And lifestyle medicine is actually a medical specialty that is based on the evidence behind the major killers of Americans, and that's chronic illnesses. And how our lifestyle behaviors, our day-to-day routine lifestyle behaviors affect our risk of chronic diseases like atherosclerotic heart disease or cancers or diabetes or hypertension or hypercholesterolemia, etc. And the 6 pillars that basically are the engines of lifestyle medicine, the evidence that we study, the behaviors that we are centered on is nutrition, exercise or physical activity, sleep, avoiding risky substances like tobacco or illicit drugs or excessive amounts of alcohol, stress reduction, and most importantly, social connection or positive social connections, our relationships. So these 6 lifestyle behaviors and the evidence, the science behind these behaviors and how these affect the risk for chronic illnesses and mortality, that entire medical specialty is lifestyle medicine.
Wow, we're definitely going to want to dive deep into some of that. Just starting at the beginning, though, what drew you to the idea of getting an additional certification in a relatively new field like lifestyle medicine?
So I think it was partly my own personal selfish desire. I wanted to figure out how to, make myself and my family healthy. And also professionally, I was basically very jaded, very sort of, what the word is thrown around these days, burnout. Or just, not feeling like I was practicing to the top of my license. I didn't think I was giving patients the best therapy. As you all know, I'm a board certified endocrinologist. So my specialty is, diabetes and hormonal disorders. And I cannot think of any, there are some very rare hormonal disorders that are not affected by people's lifestyle, but I cannot think of a lot of them, which are not affected by people's daily lifestyle behaviors. So I, basically get to see patients who have complications from their hormonal conditions, whether that's diabetes or whether that's, hypothyroidism. Patients only get sent to us or referred to us when they're already struggling with their, conditions. Diabetes is super complicated. They have to start insulin. Or if their thyroid levels have been normal, but they're still feeling symptomatic and they need to trial other alternative types of thyroid replacement medications. So I don't think I was treating my most complicated patients with my most effective therapies, right? If you get somebody who's got severity of a condition, then you should also match that with intensity of therapy. And I did not think I was doing that. And then I heard about lifestyle medicine incidentally, actually. That was a pleasant accident at a Harvard conference for women physician leaders. And that was really, it kind of struck my mind. I had never heard the word lifestyle medicine. And I had already been a practicing endocrine attending for around 6 years. And I had completed, of course, my training. So, I had been in medicine for so long, for 15 years, and I did not know about this specialty. So that was surprising, how my entire medical career I had escaped this. Like how is it that I'm a diabetes doctor and I never heard how to address people's lifestyle behaviors and what is the evidence, and that drew me to it. My professional need to be better, to be a more effective physician, to actually make my patients better. And also I wanted for my own personal health, my family's health, to know what is the real evidence. Like, should I get my advice from, magazine columns, or should I really study the research?
I love that.
Yeah.
It really resonates.
It really does. And such a good point that you make around like medical education, because we're all, a few years out of training, and things have gotten maybe a little bit better, but I would venture to guess that still most training programs, medical schools, residencies aren't teaching this piece around lifestyle medicine with such a specific framework. And which is frustrating, right? Because there is evidence behind it.
There is, when I got exposed to lifestyle medicine, the amount of evidence blew my mind, and how much I had not known about. It was actually a rude shock. And about the medical education, I told you I just came back from a conference yesterday, and it was a lifestyle medicine conference in New Jersey. It's called Plant-Based Prevention of Diseases. I'm shouting them out because I want them to be more widely known. But there was a gastroenterologist there, Dr. Serena Pastricha, who basically did a talk on gut microbiome and basically the effects on health, and how does the gut microbiome get affected by our nutrition and our lifestyle behaviors. And she said she actually chanced upon all the literature around gut microbiome and nutrition and lifestyle outside of her GI fellowship. She was a fellow when she had her babies, and she was trying to nurse them, and it was stressful, and she wanted to figure out why should she continue nursing. But then when she looked it up, and she found, obviously nursing will be associated, breast milk will enable her babies to have a healthier gut microbiome than formula feeding, right? So that was something she discovered outside of her GI fellowship curriculum. And she was surprised that there wasn't as much talk about gut microbiome in a GI fellow's curriculum. Right?
Right. That is surprising.
Right. So, and this was.
I hope someone was covering it.
but this is somebody I just heard, and she's a like a board certified gastroenterology attending now. This was I think maybe 6 years or so ago. I hope they teach some gut microbiome in GI fellowship now, or some nutrition in GI fellowship now, and its effects on gut microbiome, because the research has really exploded in the last 5 to 6 years.
Yeah.
But what I'm saying is that there was a definite deficiency that she talked about in her training, and this is a universal theme for
it sounds like it.
Much of medical training.
Yes. we're sometimes a little slow to catch up, but it's great to have experts like you in the field kind of putting it together. And I mean, Lisa and I went to medical school together, and I feel like we got a couple of talks on nutrition here and there.
Yeah.
Some things were woven in around physical activity, but again, no one was really bringing it together into this really like concrete framework. So you started talking about those 6 pillars. Can you talk a little bit more about, why each one's important or what you focus on when you talk to patients about those 6 pillars?
Well, those 6 pillars, each of them work in harmony and synergy. And there is tremendous evidence, like really insane amounts of body of evidence behind each one of them. So starting with nutrition, I think I don't need to belabor this, but dietary risks are basically the number 1 killers of Americans. I think ahead of tobacco. We already know that dietary risk has superseded that quite a while ago. The amount of salt or sodium in our diets, the amount of ultra-processed foods in our diet, more than 60%, I think, I forget what the data is, but at least more than 60% of all the calories that we take are coming from ultra-processed foods. And if I remember, if I remember, I think there was a JAMA study in perhaps 2018 or something, which talked about how many Americans die every minute because of not eating adequate vegetables. I think it's 1 American every 10 minutes.
Oh my goodness.
Yeah,
wow,
because of not
we
eating.
will look for that study, yes.
Yeah, and I think I can send you.
Notes.
I can send you that study. I remember making a slide from that. I think it was 2018 or 19. And similar, data for like maybe 1 American every 9 minutes or so for not eating adequate nuts or seeds, right? So dietary risk is huge. Similarly, if you go to physical activity again, the amount of reduction in mortality just by improving somebody's fitness levels or lean body mass or muscle strength or bone strength, it's like unquestionable. And the number of diseases, if you count how many diseases is physical activity beneficial in, if FDA had to label exercise as a medicine, indications, right? Like if you have metformin, indication for use, type 2 diabetes. So if you give exercise the FDA indications, how many diseases would you be able to use it in? Can you guess? Over a dozen.
Literally
Over
all
a
of
dozen.
them would be my
all
guess.
Of them. All of them, whether you start.
Is there an upper limit, really?
Yeah.
There is, so it would be labeled an antidepressant, it would be labeled an anti-diabetic, it would be labeled an anti-dementia, it would be labeled an anti-heart disease, anti-stroke, anti-cancer. I mean, really, like you said, bringing down the cholesterol. So, the benefits of exercise cannot be overstated. And then sleep, which I think is the most ignored pillar in American health. I think that is, and that really is, and I don't think we are paying attention to this epidemic. But, in the 1960s, an average American adult was sleeping a minimum of 8 hours every night. And then today, and this is pre-pandemic, so I wonder if pandemic has taken an even worse toll, but in the modern day, an American adult sleeping only 6.7 hours every night, which is a huge,
I do find that hard to believe,
which is a huge deprivation of sleep if you look at a population's health. And, this is really unheard of in human history. Human beings have not been designed to have chronic sleep deprivation. Right. And the impact on, just acute inflammation levels or the risk for dementia, the risk for strokes, etc., can actually be worse than what it would be if somebody smokes tobacco or remains sedentary. So between, choosing and what's unhealthier, remaining sedentary or sleeping less. Sleeping less is actually more harmful.
It's hard to hear.
Oh, my goodness.
And then I don't think we talk about it with as fervor and as intensity. Like, there are multi-billion apps and startups about nutrition and AI trying to fix people's nutrition. And then, if you look at the exercise industry and the trackers and the gym industry, there's a lot. But nobody's spending money on sleep. Nobody's, really paying attention to the fact that adolescents are at an alarmingly sleep-deprived sort of state in our society, our teenagers, and the mental health. I think a huge proportion, a huge proportion, maybe 30%, maybe even more, of the adolescent mental health crisis would be solved if they were getting at least 8 hours of sleep at night. So there is
That
that.
is a great
yeah.
point.
And nobody's talking about it, and there's not enough
Right,
money
you're
behind
right.
it.
You're right. That the alarm is not being sounded. And
There's just
our
not enough
episode
money in this.
15
Yeah.
Right. And we'll link to that in our show notes as well, because we did do an episode on insomnia and sleep disorders. And I think you are right. It's not at all seen like the emergency that, from a medical standpoint, it potentially is.
Mm-hmm.
Especially with the screens and the the fact that
Right.
high school students have to wake up pretty early. Their school times
Exactly.
Oh, yeah. This is, I have a new high schooler, so this is a very significant issue for us. We actually, my husband and I submitted testimony to the county to change the start times. They did, but then backtracked after the second week because they had difficulty with bus scheduling and all these other, the domino effect of scheduling. But it's interesting to me that, a school system which, of course, should have the health of their teenagers at the forefront. The requirements of so many other conflicting interests push their biological need for sleep to the bottom of the priority list.
Yes. Yes.
So many competing interests, right? Like sports and work and all of those. But right at the end of the day, if those teenagers are at higher risk of depression or even a shorter lifespan, it's, I feel like those other things probably should take a back seat to making sure that they're getting enough sleep.
Right.
Well, I think all of these other logistics and business and economics, they're not, everything else is, you're right, it's a backseat. Sleep is non-negotiable. Sleep is non-negotiable if somebody is talking about not just chronic effects, but even acute effects. The impact on I think the data is very solid. So if somebody is, deprived of sleep for out of 8, if they had 4 hours of sleep, that would be tantamount to their cognitive impairment, almost as much as, I think, having a serious blood alcohol concentration level of something that would be beyond the limit that they're allowed to drive. So what I'm trying to say, so what I'm trying to say is if somebody only slept 2 hours or 4 hours, then they might be as cognitively impaired while driving in the morning as somebody who's actually drunk, legally drunk. And I don't know the exact numbers, but I can send you that after the show, exactly what are the hours of sleep deprivation tantamount to how much is the actual alcohol concentration. But so there are acute effects as well of sleep deprivation. And I think you all are aware of the statistic where, we do this experiment twice a year with the daylight savings time.
Yeah.
Oh my goodness.
We've talked about this before.
Yeah. And so, the day that we all as a collective, as a nation lose 1 hour of sleep, the number of heart attacks the following morning is, the following day, I should say, the following 24-hour period is, I think, 21% higher or something much higher than the
staggering
average.
Yeah.
Yep, and ER staff report that every year.
Yeah. So there are acute effects of, just sleep deprivation even for 1 night or 2 nights. So that's the third pillar, and there's so much evidence, it's not even funny. And then the fourth pillar is basically avoiding risky substances like tobacco. I mean, I don't think I need to say that. Fortunately, the consumption of tobacco smoking has been going down, but then I think tobacco is also making a little bit of a comeback through e-cigarettes and vapes.
Exactly.
Right.
So that, and the addiction potential and the long-term sequelae, whether that's on lung cancer or heart disease or other ailments like bladder cancer, etc. So and even diabetes risk, people who smoke tobacco are at a much higher risk of getting even type 2 diabetes and other conditions, autoimmune conditions as well. So that's one of the things in that fourth pillar. Of course, illicit drugs, marijuana, opioids, and other addictive potential drugs. And then, of course, excessive alcohol as well, which I think is something that is not talked about a lot in popular media. And, some people might even think that moderate amounts of alcohol are good for heart health. But now the literature lately, I think some media are covering it. There was a huge article in New York Times a while ago, I think it was in the spring of 2023, about how that was all based on non-evidence, really. There wasn't much science to back that claim that moderate amounts, that people have to drink a little bit of red wine in order to have a healthier heart. And even moderate amounts of alcohol consumption may be associated with detrimental effects on long-term health. I think the biggest one is cancer risk, particularly breast cancer risk. In fact, the World Health Organization, they actually classified alcohol as I think it's a probable carcinogen. And they do recommend that different organizations or governments consider putting the same type of warning label on alcohol bottles, like there are on like tobacco or cigarette packs, etc. So
like
alcohol,
a Surgeon General's warning sort of
exactly
label?
like a warning label where people should know that tobacco consumption or alcohol consumption is injurious to health. And alcohol is considered cancer's best kept secret. So that's one. But then, of course, there are other problems with alcohol, including fatty liver and cardiomyopathy in certain people's cases. People may not even know that alcohol is one of the leading, actually the leading risk factor for men osteoporosis. Now, for women, of course, it's menopause. But for weak bones or osteoporosis in men, the number one risk factor is alcohol consumption. Wow. So excessive alcohol. I mean, if somebody is a social drinker or drinks in real, limits, and they're not addictive or, harmed by that consumption, it perhaps is okay. Somebody who doesn't drink at all, they should not start drinking just because it's healthy for the heart. Or it's, the popular myth goes that it's healthy for the heart. And then if somebody has problem drinking, they need to work on that. So
what's
those
considered excessive drinking?
So I think...
are there particular numbers based on age, gender?
Yes. So most of the guidelines, including the American Cancer Society, they define this as, I think, 1 drink a day for women. And ideally, there are at least 2 nights of or 2 days of break in a week. So, maybe drinking not more than 5 out of 7 days. And for men, it is 2 drinks a day. And again, ideally not more than 5 out of 7 days. So that's considered, above that is considered risky drinking. But then it can also depend on, whether people are binging. And I think most of this data is in the developed nations population, in the Western population. So for people who are in, who are immigrants from Asia or other parts of the world, I don't know if they may have a lower threshold, particularly South Asian women or East Asian women. Would they be harmed by even really like moderate amounts of drinking, even 1 drink a day?
Right.
Depending on, how much their body, their alcohol dehydrogenase enzymes can metabolize the alcohol. So, I mean, the data is pretty strong on how alcohol can affect the gut microbiome. I think lately there is a huge amount of interest. Just like if we use alcohol sanitizers, it kills the bacteria because it's a sanitizer. Similarly, drinking alcohol orally can also harm our gut microbiome. So there's a huge amount of research
that's a great point. Yeah.
So that's the 4th pillar. And then the 5th pillar is stress reduction, which again, I think is among the top killers of Americans. I think a lot of primary care visits happen because of stress. One of the leading reasons why people come to their primary care physicians. And there was never a time in human history when we did not face stress as a species. We always had predators and
wars
and wars and famines and floods and plagues, right? So we always had stress, but we perhaps had tools and resources in place,
right,
that we were practicing in order to deal with stress. And these are things, these are things that are already, our body is armed with, is equipped with. Our parasympathetic nervous, how can we activate it? Can we take a deep breath? Can we take a certain, do certain practices daily? They're called pranayam or cohesive breathing. Or is there meditation? Is there running? Is there some other way to constructively deal with stress? and engage our parasympathetic nervous system to bring down our heart rate, our blood pressure, to calm down the amygdala and, come more to the prefrontal cortex. So that there is a lot of evidence nowadays, or not nowadays, but there is a lot of evidence accumulating on, modalities like mindfulness-based stress reduction, or a lot of things, deep breathing, and a lot of different modalities. Yoga, of course, we are studying. So researchers across the country, not across the country, across the world are studying how we can teach people better coping strategies in order to reduce stress, particularly, doctors or busy professionals or students, so that they don't have downstream unhealthy responses in terms of their lifestyle choices, whether that's their nutrition choices, whether that's their drinking choices or addiction choices, etc. So the evidence field behind that's huge. And then last pillar, which is again, I think it's my favorite pillar, but I think fortunately now with the Surgeon General Vivek Murthy recently actually bringing out a scientific advisory on loneliness, the loneliness epidemic, and social isolation. I think it has become a hot topic finally. It always was, but we are facing catastrophic levels of loneliness. Our elderly, our youngsters, and that became very actually remarkable during the pandemic. But due to influences like social media and many other factors, even our youngsters are more lonely than ever. So it is a pandemic. It is, or at least an epidemic for us as a country, and that again has a huge field of evidence behind it. I think the numbers are stark. Like loneliness is associated with a 50% higher risk for Alzheimer's dementia. And I think, and even worse risk for mortality, premature mortality. Heart disease, again, I think heart attacks or heart disease is at least 30%. But, people who are subjectively lonely or objectively isolated and they live alone are much higher risk of dying early and suffering from chronic illnesses. So, how can people, come together and be part of constructive social relationships, whether that's with their family, whether that's with their workplaces, whether that's with their communities or churches, or any other place they feel that they belong, because we all long to belong. But how can we, study systematic evidence-based approaches where our patients can feel less lonely and more connected? Because I think that as, if I'm a doctor and I know that my patient's biggest risk of dying is because they live alone, then I obviously need to also figure out how I can equip myself with the competence where I will be able to solve that problem for them with ease. How can I connect the dots with my social worker or with some other, sort of resources that I can channelize so that my patient can get what they need, which is connection. And that, I think, is something that all medical students, all of our health professionals need to learn.
Thanks so much to Dr. Mahima Gulati for a great primer on what lifestyle medicine is and how it can benefit all of us. For more information on her background in lifestyle medicine as a whole, check out our show notes at hippocratichost.com. And make sure to tune in to episode 60 for part 2 of our interview, because she shares even more information about health equity and overcoming barriers to using the tenets of lifestyle medicine to improve all our health. So that's our show for today. Thank you as always for listening and for all your support. Please follow us on Facebook, Instagram, and other social media platforms, and subscribe and review us in Apple Podcasts, because reviewing helps other people like you find the show. And if you'd like to support us with a monthly donation, just go to our website at hippocratichost.com and click on the Become a Friend of the Show button. We'll be forever grateful.
And keep sending those messages with topics you'd like to see next. Thanks, everyone, and talk to you soon.
Thanks for listening to Health at Home with the Hippocratic hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.